Hello, my name is Dr. Brian Reid, and I'm a naturopathic doctor. And this is a video about treating a case of migraines using something called low-dose immunotherapy. I won't get into too much of the nuts and bolts of what is involved with low-dose immunotherapy in this video. I've posted other videos about it before. I also have a long 45 or 50-minute long video on YouTube all about low-dose immunotherapy. So if you search my name and low-dose immunotherapy on YouTube, you can find that video or watch a shorter clip in somewhere in my profile or down below if you're watching this on Facebook. So with low-dose immunotherapy, though, in a nutshell, it basically helps to get rid of an allergy or sensitivity, or helps to address an allergy or sensitivity that a person has to some type of substance. So it's kind of like doing allergy shots, just without using needles. It's done via a sublingual method, so putting drops of the allergen solution under one's tongue, and then it's used that way. We used to do it as injections, but then over time it turned out that the clinical experience with it, with my practice and others, we found that it just worked just as well sublingually, so way easier, less painful, and all of that. So ultimately, we desensitize patients using this therapy to a variety of substances. And so this case that I wanted to talk about is a case where a patient was suffering from chronic migraines. Now with this case, when the patient first came to see me, and this was several years ago, they were having some digestive issues and some fatigue issues, and then also migraines, like just more days out of the month than not, they were having these really debilitating migraines, which was awful. And so we cleaned up the diet, got their IBS symptoms under control by treating them for small intestine bacterial overgrowth. So energy's better, gut's doing great, and the migraine levels dropped down a little bit, but not a ton. We ended up putting the patient on some high-dose magnesium as a supplement. Migraines got markedly better, but the patient was still getting migraines like clockwork mid-cycle and premenstrually. So just every month she was getting migraines at that time. And so it was a lot better than having migraines most days of the month, but she was still having them a couple of days every month. And so she wanted to get rid of them the rest of the way, and I wanted to as well. We always striving to get people as healthy as humanly possible. So given the timing of the migraines, I thought, well, there sounds like there's a hormonal component here. Mid-cycle, that's when we're kind of more suspicious that there might be a progesterone-mediated component, or at least in my practice, that's what I've seen. And then premenstrually, suspicious that there might be an estrogen-mediated component. And so I recommended that the patient take some progesterone low-dose immunotherapy around the middle of her cycle, and then some estrogen low-dose immunotherapy around her premenstrual period. So like a couple of days before she was likely to start getting those symptoms, like start getting the migraine symptoms. I said, just preemptively start taking this, and then let's see how it goes. And lo and behold, over the next several months, she had one or two breakthrough migraines. They were shorter duration, less intense, and she was really, really happy. And the patient, continued to take the low-dose immunotherapy formulas for several months afterwards, just for good measure, but then eventually stopped taking them. And for the most part, over the next few years, she was migraine-free. She always kept some of the estrogen and the progesterone low-dose immunotherapy formulas handy at home, just in case she started feeling some symptoms coming on. So there was a few times over the subsequent few years that she had to pull them out, but it nipped it in the bud and worked really effectively for her. So I like this case because it's always nice when cases have a good, happy ending. She was, doing really well, and that was great. All the loose ends were tied up with that case, but it's a really great example of how low-dose immunotherapy can be very helpful for a range of different conditions. If a person's having a sensitivity or allergy to their own hormones, like to their to estrogen or progesterone, maybe testosterone, maybe to thyroid hormone, or maybe to some other substance that you wouldn't normally think of as having a sensitivity. Some people are sensitive to the yeast that naturally lives in their bodies, or the strep that naturally lives in their bodies, or they might be sensitive or allergic to some type of microbe that they've been exposed to in their life, whether it's the Lyme disease causing bacteria, Borrelia burgdorferi, whether it's some other type of what's called a Lyme co-infection, like Mycoplasma or Bartonella. There are a range of different microbial types that people can potentially be sensitive to as well. And the really fascinating thing, and I think wonderful thing with low-dose immunotherapy, is that we can create or access formulas that are tailored to whatever a person might be sensitive to. So I've had patients where they're on, parenteral nutrition, so like they're getting nutrients from they're not consuming nutrients like through their digestive tract, and because they can't for one reason or another, and yet they're reacting to those nutrients, like they're getting inflammatory symptoms or something like that from those nutrients. And so we can literally take some of the formula that's being used, dilute it down into a low-dose immunotherapy formula, sterilize it the whole 9 yards, and then the patient can take that. And I've had patients where that's helped them to be able to tolerate those formulas more effectively. So it's a really versatile therapy, and it's just something I can't say enough good things about. I search far and wide for the most for innovative, new, effective therapies, and low-dose immunotherapy is definitely on my top 5 list. Maybe top 3 list. It's hard to pick. It's like trying to pick a favorite child. LDI is definitely up there. So, anyways, if there's any questions about low-dose immunotherapy or any other topic, feel free to post in the comment section below. And otherwise, I hope this information was useful.